the infection?
None of us are satisfied to know that there is the spread of COVID-19 in one of our personal care homes. We are concerned. What I can update Manitobans and let them know today is that everyone is working very hard to mitigate, to keep people safe. I can tell you that, of course, that facility has been put into the red. We know that regular things like meals are now being delivered to the room instead of having congregant meals. PPE is being worn at all times. There is infection prevention and control specialists on site and assisting from the WRHA. The WRHA has a response team that they have made available if there are staffing concerns. We know that the operator is also moving other workforce to be able to accommodate, but still keeping people safe and making sure that workforce isn't working in two care homes at the same time. I would also indicate today that there is now a physician on site that is there from the operator full-time, and then administration from the Parkview themselves is on site 24/7. So I would tell people, no one is satisfied. This is a lot of cases. I think Manitobans have accepted that COVID-19 has a way of getting into long-term care facilities. In Manitoba for a long, long time, our situation was enviable if you were other provinces. There are 220 unique outbreaks right now in Quebec, Ontario, Alberta, and BC when it comes to long-term care facilities. We are not immune to that either.
How do you know that these protocols are being followed if a public health official hasn't visited the facility?
So we know those protocols are in place because we are in constant communication with the personal care home. There is interaction at all times between the WRHA, the provider, the operator, the Department of Health, and of course Public Health also has that role of overseeing, and Public Health had made the decision to suspend temporarily that one worker, one site policy.
Are we going to see some new measures announced tomorrow for the Winnipeg region?
Yeah, that's probably predictable. In Winnipeg right now, reporting as we did numbers north of 150 again. We've got more to do, obviously, in this province and in this city. I think the Premier made the comment this morning that, for a long time we were all focused on the fundamentals and we got good results because of that. And I think that as the intent of people or just the capabilities or the willingness to comply has waned slightly, people are tired, genuinely, they're tired of doing the right thing. We've seen those good results drop off. So we need that reminder. Yes, Winnipeg right now is in orange as that designation, but clearly we could do more. And if you look at the pandemic response system, that orange designation would allow us to do more. I won't speak to specific measures today, but I think I could give you this hint and say that where we would see people most at risk, you could expect to see more measures coming to address that. And where we are seeing the spread of the virus taking place, you could see targeted measures coming to also address that.
Do you think that the province bears some responsibility in terms of messaging? Because in the summer lull, bar patios were open, restaurant patios were open. We were told you could, gather in groups on a bar patio. And later, even with the reduction to 10 people in Winnipeg, it's household plus 10. So people, I think that it's okay to go and socialize with people outside your household, as long as you're at that number.
Well, I would say this. I mean, none of this is easy, and for every jurisdiction, with every other Minister of Health with whom I'm speaking, none of it is straightforward. You talked about the middle of the summer when people were gathering on patios. Yes, but in the middle of summer, we had a 3-week period where there were no cases reported in the city of Winnipeg, and indeed in the province of Manitoba. And so I think that, we have to understand the way we responded at certain points in time. I believe that the pandemic response system that we've put in place is broadly working. Now, you can say, well, Minister, there's a lot of cases in Winnipeg. Yes, but now we've been able to elevate the level of risk in Winnipeg appropriately and differentially from the rest of the province, because right now, of course, those cases in Interlake Eastern or in Southern Health are fewer. So I believe that we need to continue to put our faith in this system. We need people to do the right things, and we will sort it out as we go along. I don't want that to sound glib. I want to say that we we have perhaps collectively let our guard down, and we believe that that elevated level of risk could be an important reminder to people to put their guard back
But
up.
has the province played a role in letting people let their guard down because they're told you can gather in, with your household plus 10 other people?
Well, I think the reason we've done that in respect of the 10 plus 10 is that in some households you can have as many of 10 people living there. So we've tried to be equitable in terms of how we have allowed people to gather, but clearly there too. Tomorrow, those things will be scrutinized, and perhaps tomorrow we will see some change in terms of the numbers of people that are being asked to gather. We're saying to people, now would be a good time to rethink your weekend plans. And if you were thinking about getting together with a bigger group, maybe it's time to just focus on the few people who are in your bubble. This is a really good chance for Winnipeggers to get back on track, and we'll continue to try to deliver that good message and remind people to do that.
So is the gathering numbers of 10 drop to something below 10?
Well, I'm not going to
Perhaps
telegraph
5?
what's coming tomorrow because the orders are not yet written, but let's just say that there will be a number of things on the table for tomorrow, both, I would say, those specific measures, but maybe also some broadcast measures to help us get back on
So
track.
5 perhaps?
We'll see what happens tomorrow.
Are you
12:30, be there.
Are you comfortable with the hospital levels and the capacity within the hospitals for the healthcare system to handle a COVID surge, especially now with hitting the flu season, to be able to handle a surge from flu or a respiratory virus?
Yeah, well, they always say that in public health in a pandemic, job one is preventing mortality and hospital saturation. So when you say, are we comfortable with the number of people in hospitals? No, I mean, we would rather it was fewer, and we have seen a slow increase of the number of people in hospital, although it's been quite stable. Slow increase of the number of people in ICU, slow increase of the number of people who are ventilated. Clearly, 0 would be better than our current numbers, but I would say this, that we continue to see that the epidemiology, and I'm no public health officer, but the epidemiology looks different than it did in the spring. And even though we have these higher case numbers, we are not seeing a commensurate number of people in hospital. Now that could be because it is that younger demographic right now that is seeing the higher numbers. But clearly we have to keep control of this. People cannot become lackadaisical because it's exactly the kind of spread that will eventually see increase in hospital where we must guard our capacity.
Do you have any